Hello and welcome to today's seminar, CRVS Legal and Regulatory Review, Best Practices with a Gender Lens. This seminar is the final session in our 7-part series on gender foundations in health data. I'm Dr. Michelle Kaufman. I lead the Gender Equity Unit of the Data for Health Initiative. I hope you enjoyed our musical selections today by female artists from Uganda, South Africa, and the Philippines. Today's seminar builds upon the first 6. We will dive deeply into how to use data collected and analyzed in CRVS and other population-based systems. And we will talk about how to examine and recommend changes to a country's health policies and regulations on behalf of women, girls, and non-binary people. Our primary goal with our work in gender equity is to improve health outcomes for all, finding ways within and outside of existing structures and systems to collaborate for positive change. Today's seminar focuses on the Global Health Advocacy Incubator's CRVS Toolkit, created in collaboration with Vital Strategies and the Center of Excellence in CRVS, which is now part of UNFPA. The toolkit provides resources and best practices for conducting a legal review of the laws and regulations in a country related to civil registries and vital statistics. This is critical to our gender equity work, as the law brings a layer of accountability to our work in diversity, equity, and inclusion. Now I'd like to introduce Chrystie Swiney, Associate Director of the Data for Health program at the Global Health Advocacy Incubator. She will be providing an overview of the toolkit, as well as an introduction to the 3 new chapters that will be presented today: Women and Girls, Stillbirth Reporting, and Equal Access for LGBTQI Individuals. These chapters will be presented in turn by our next speakers on the panel, Olga Joos and Schwid, and 2 additional speakers will talk about in-country implementation. Hadijah Namyalo will present about child marriage and CRVS in Uganda, and Sophia San Luis about challenges and opportunities of using a gender lens for CRVS legal review in Southeast Asia. As you may be able to tell, this is a robust learning opportunity with a wealth of valuable experience to be shared. Let me start by formally introducing Chrystie Swiney. Chrystie is an attorney with expertise in international, comparative, and human rights law, and over a decade of experience in international development work. At the Global Health Advocacy Incubator, she oversees CRVSID legal reviews and legal reform work for the Data for Health Initiative. Chrystie has initiated and overseen legal reviews and legal reform projects in nearly 20 countries throughout Africa, Asia, and Latin America. Before her work at the Global Health Advocacy Incubator, Chrystie held legal positions at the International Center for Not-for-Profit Law, the Constitution Project, and the U.S. Department of State, where she served at the U.S. Embassy in Baghdad. Chrystie has also taught courses on law and politics as an adjunct professor for the College of William and Mary, and served as a legal research fellow at Georgetown Law Center. Chrystie holds a JD from Harvard Law, a master's in international relations from Georgetown, and a master's in modern Middle Eastern studies from Oxford. Chrystie, welcome. So great to have you.
Thank you so much for that kind introduction, Dr. Kaufman, and happy Wednesday to all of my esteemed colleagues who are attending this final seminar today. It's a great privilege to have this opportunity to speak about the CRVS legal and regulatory review through a gender lens, and more specifically, to discuss its importance to achieving gender equity. Let me begin by saying that a CRVS legal review has always, first and foremost, been focused on equity concerns. At its core, a legal review is focused on ensuring that the legal frameworks underpinning a country's CRVS system ensure that everyone, no matter their gender, their race, their nationality, their sexual orientation, or any other distinction that one can imagine, that everyone is able to easily and affordably access civil registration. Those of you in the CRVS world will know that universality is one of the foundational principles of a strong CRVS system, with universality referring here to equal access for everyone, men and women alike. Ensuring that everyone has access to civil registration services, notably including birth and death registration, benefits individuals and governments alike. Many of us know this already. For governments and policymakers, the data generated from civil registration systems is critical to generating accurate and complete vital statistics. And accurate and complete vital statistics, of course, are critical to developing informed public health policies and targeted intervention programs, such as those that focus on improving maternal and fetal health. For individuals, access to civil registration is the gateway to realizing one's human rights and to living a full and meaningful life. Without birth registration, one is typically unable to enroll in school, to receive a national identity document or a passport, to get a job, at least in the formal economy, to open a bank account, to purchase a home, to take out a loan. Those whose births are never registered are among the most vulnerable individuals in the world. They are more likely to end up stateless and without a nationality, and to live a life of poverty, hardship, and exploitation. All of these extremely dire consequences of not registering one's vital events apply to everyone, of course, men and women alike. However, they are especially pronounced and severe when experienced by women and children. And we know from surveys and existing research that women and children are much more likely to face obstacles when attempting to register their births and deaths. Next slide, please. So returning to a CRVS legal review, what is a CRVS legal review? The purpose of a CRVS legal and regulatory review, which is offered to focus countries in the Data for Health initiative or to global grants programs countries, the goal is to identify obstacles, gaps, or bottlenecks that exist within the existing laws and regulations, which are preventing universal access to civil registration and the production of accurate vital statistics. A legal review is a carefully guided step-by-step process that's done in close consultation with an in-country legal consultant. You'll meet one of these today, Ms. Hadijah. It's done in close consultation with an in-country legal consultant, whereby all the relevant CRVS legal documents are closely analyzed and compared against international best practices. A legal review culminates in the issuance of a recommendation report, which contains concrete, actionable recommendations for specific legal reform. So you might ask, why does this matter? Next slide, please. You might ask, why does this matter? Why does the law matter? Why can't we bypass this step and go directly to CRVS system strengthening? The reason is because the legal framework that supports a country's CRVS system is the skeleton or the backbone of that system. It holds the entire system up by establishing the overall structure for CRVS procedures and practices. The law also establishes the specific roles and responsibilities of each of the key stakeholders and actors necessary to complete the registration process. And the law is what provides uniformity, standardization, and consistency, all of which are essential to the production of accurate statistics. And perhaps most importantly, the law is what holds individuals and governments to account. Without the law, everything is effectively voluntary and at the good graces of those involved. So the law not only establishes the rules, but it provides the incentives and the enforcement mechanisms to ensure adherence to those rules. Next slide, please. A CRVS legal review is completed using the CRVS Legal and Regulatory Review Toolkit, which Dr. Kaufman mentioned. This was created in partnership with other Data for Health partners and global CRVS experts, which include Aaron Schwid, Olga Joos, and Sophia San Luis, who will be presenting later today. The toolkit clearly and concisely outlines the international best practices associated with each of the topics that it covers. And it provides a detailed framework and methodology for analyzing a country's existing laws against those best practices. Next slide, please. The toolkit has been an evolutionary document. It has grown and expanded over the years. It currently contains 13 chapters, each one on a different topic pertaining to CRVS. Most recently, we added 3 new chapters, which were designed to specifically ensure that the legal review addresses the unique obstacles faced by women, children, and those in the LGBTI community. Next slide, please. The toolkit has now been translated into French, Spanish, and Portuguese. And so far, we have initiated legal reviews or legal reform projects in 26 countries spread throughout Latin America, Africa, Asia, and the Pacific Islands. Many of these legal reviews are still active today. Next slide, please. Returning to the 3 newest chapters in the toolkit, which are listed on this slide, we added these new chapters in an effort to be more intentional about ensuring gender equity within the legal review process. As I mentioned earlier, the principle of universality, which I would argue encompasses the concept of gender equity, has always been at the heart of a legal review. But by adding these new chapters, we now take a more focused and detailed look at the common obstacles and barriers faced specifically by women, children, and those in the LGBTI community when attempting to access CRVS services. And we suggest ways that the law can be used to eliminate these barriers. In my brief remaining time, I will quickly introduce the new Women and Children chapter, and I will then hand things over to Ms. Hadijah Namyalo Ganafa, my in-country legal consultant in Uganda, who will then discuss one of the most important topics contained within this new chapter, namely child marriage. Dr. Olga Joos will then discuss the Stillbirth Reporting and Registration chapter, and then Aaron Schwid will discuss equal access for LGBTI individuals. Next slide, please. So in brief, the inclusion of Women and Children chapter details the importance of accessing CRVS services for women and children and the unique challenges that they often face. While some of these challenges are legal, many fall outside the law, of course. There are cultural, social, or religious obstacles that are often present as well. As an example of where the law can provide an impediment to women, in some countries, the law requires a father's name or a marriage certificate, or in some cases both, in order to register a baby's birth. This legal requirement would prevent single mothers or mothers who have been victims of sexual assault, who are unwilling or unable to name the father, from registering their child. An example of a non-legal barrier would be women living in traditional societies who are tasked with childcare and domestic duties. They might be unavailable during regular office hours and unable to visit their local registration office. They also might be without transportation, or they might be illiterate, preventing them from performing the service on their own. We know from existing surveys that these legal and non-legal barriers are, in fact, preventing many women and children from registering their vital events. Indeed, over 45% of women in low-income countries lack birth certificates and identity documents. Women and children who are without birth certificates and therefore unable to prove their actual age are much more vulnerable to child marriage, child labor, and child military recruitment. Next slide, please. The benefits of civil registration, I've mentioned many already, basically fall into three buckets. First, protection against a life of exploitation and hardship. Second, access to essential services and sectors such as education, employment, and so on. And third, the availability of public health interventions, welfare programs, public support, public assistance. These things oftentimes are created and inspired by the data created by civil registration. Next slide, please. Okay. And then one thing I think is often overlooked that I wanted to specifically highlight here, oftentimes we focus on the benefits of birth registration, but there are also many benefits, especially for women when we talk about death registration. Death registration can be just as valuable to women and children as birth registration, as proof of death registration is typically required by law in order for a widow to access inheritances, pensions, property rights, and other widows' rights. Proof of death registration is also typically required in order for that widow to remarry. As with the benefits associated with birth registration, the benefits of death registration are especially meaningful and impactful to women who live in traditional societies or who are illiterate, impoverished, or have no financial independence separate from their deceased spouse. So in many cases, death registration will provide their only means of financial survival. Next slide, please. And in a quick recap, these are the topics that are covered in the New Women and Children chapter. I don't have time, unfortunately, to go through them here. But as I mentioned, child marriage is a recurring issue that has come up in many legal reviews that we have conducted, and that will be presented on next. Next slide, please. As a final comment, I'll note that the law is necessary, but not sufficient. It's not a panacea. It's not a cure-all. It's an essential first step, but of course it cannot solve all of the problems. Thank you so much for this opportunity to present on the legal review and its importance to achieving gender equity. I look forward to the Q&A. Back to you, Michelle.
Thank you very much, Chrystie. That was a great foundation and very easy for those of us who don't understand legal jargon to understand. I'd like to introduce our next speaker, Hadijah Namyalo Ganafa, who will be discussing how to use civil registration to reduce child marriages in Uganda. Hadijah is a Ugandan lawyer and academic. She teaches law at Makerere University School of Law in Kampala. She currently serves as the in-country legal consultant, as Chrystie mentioned. Hadijah has undertaken several consultancies in areas relating to vulnerable groups, including women and persons with disabilities, and she has published in these areas. She intends to pursue her PhD, and her thesis will focus on the specific challenges faced by women and girls with disabilities when attempting to access civil registration services. Hadijah received a Bachelor of Law degree from Makerere University and a postgraduate diploma in legal practice from the Law Development Center in Kampala before she earned a Master of Law and Legal Studies from Cornell Law School in Ithaca, New York. Hadijah, welcome. You have 10 minutes.
Thank you very much, Michelle. Good evening, everyone. My internet is not very stable, so I'll switch off my video. So I'm presenting about possibilities of using civil registration to end child marriage in Uganda. Next slide, please. A child marriage basically means any kind of union that is held between persons who are under the age of 18. It could be the bride or the groom, but as long as one of the parties or both are below the age of 18, then that qualifies to be a child marriage. And as we are aware, child marriages are prohibited by international law, which Uganda ratified. But despite this, we have high rates of child marriage in Uganda. Next slide, please. So we don't have current statistics showing the prevalence of child marriage. The last time we got statistics was in June 2015. And when you look at that slide, it's only in central, southwest, and Kampala, the capital city, where less than 50% of children experience this. But the rest of Uganda, half of the children get married when they're below 18. Next slide, please. Like I mentioned earlier, child marriage is prohibited by several laws, and the international laws include Article 16 of the Universal Declaration of Human Rights, Article 1 of the Convention of the Rights of the Child, Articles 23 and 24 of the International Covenant on Civil and Political Rights, Article 16 of the Convention on the Elimination of All Forms of Discrimination Against Women, that is the CEDAW, and lastly, Article 21 of the African Charter on the Rights and Welfare of the Child. Next slide, please. Ugandan Constitution prohibits child marriages by virtue of ensuring that it stipulates that you must be aged 18 and above and be able to consent to the marriage. And that is what Article 31, Clause 1 and 3 of the Constitution states. Next slide, please. Despite what the Constitution says, we have several laws which contradict what we have just indicated. And these include the Customary Marriage Registration Act, which allows girls aged 16 or 17 to actually be married. And we also have the religious marriages, like the Hindu marriage law. It allows a 16-year-old girl to get married for as long as she has the consent of her guardian. And then we also have the Marriage Act, which talks about consent for someone who gets married below the age of 21. In my opinion, I think the consent should be about situations where a person, say, is not sure whether they're 18 or 19 because of the fact that majority of the Ugandan children are not registered. So it shows that the existing customary, statutory, and religious laws enable parents and guardians to marry off their underage children, and this makes it very common in the rural areas. Next slide, please. So why are we concerned? Why are we talking about child marriage? It's very important because globally, about 33,000 lives every day become subjects of child marriage. And according to UNFPA, State of the World Population Report, if things do not get under control, about 650 million girls, if things do not change today, another 150 million girls will be married off. So currently, when you look at the people in the age brackets of 25 to 49, most of them in Uganda were married before the age of 18, and globally, this has been the case as well, because we have 650 million girls. So there's need to ensure that this stops because, one, if a girl is married off in Uganda, they're not marrying them off because they want to, but usually the parents are in a bad financial situation, so they're trying to get what we call bride price for their families. As a result, the young girl ends up lacking the chance to get educated. And once you're married as a child, you also lack the ability to make important decisions because usually it's the much older men that can afford to pay this bride price, which means that once you're married off, you cannot decide how many children you want to bear, if you want to work, or if you're doing activities like farming, how will you manage your finances? Next slide, please. So in addition to that, we have very many health risks that are associated with child marriage. And these include the poor mental health outcomes, because sometimes girls get suicidal thoughts or others attempt to commit suicide. Then there are high rates of complications during labor and delivery. We have eclampsia and anemia. And then we have increased morbidity after childbirth, and of course, the increased risk of mortality for females that are aged 15 to 19. So we should always remember that whenever we leave child marriages to continue to thrive, we are also increasing the chances of mortality and morbidity. Next slide, please. So we're trying to think that civil registration can come to the rescue. And how is this possible? For starters, in Uganda, we have the Registration of Persons Act, which provides for the compulsory registration of births and registration for purposes of acquiring an identity. So if we ensure that these laws are implemented, it means that everyone in Uganda with time will have a birth certificate or an identity card. Once we have achieved that, our next step will be to ensure that the laws are amended to require that every couple intending to get married must show their birth certificate or national or alien identity. Maybe what I need to emphasize is that the national identity is for the Ugandan citizens, whereas the rest of the foreigners get what they call the alien identity. So in order for a person to be part of a marriage celebration, the registrars should require both parties to appear before him or her so that they check out the birth certificate or the national ID, but it's preferably the birth certificate because you cannot change it. And once this is looked at, they will be sure that the persons intending to get married are above the age of 18. In addition, in Uganda, we have different other marriages that are conducted as a result of culture or religious beliefs. So in such a case, the religious and customary leaders should be responsible for ensuring that both parties going to contract a marriage are above the age of 18, and they should remain with copies of the birth certificates to prove that actually they are not promoting child marriage. Next slide, please. So what's the way forward? From a legal perspective, it's clear that child marriage can be eliminated. How do we achieve this? We achieve this by closing all the loopholes. Like I've mentioned, the customary laws, the religious laws permit people to get married when they're below the age of 18. So the law should be amended to require that every single person intending to get married must be 18 years old and above, as required by the Constitution. In addition, they should amend the laws to ensure that there's a process that is clear, that requires a person to ensure that before you get married, there's proof that you're above 18. How would this be achieved? This can be achieved by ensuring that a marriage certificate is provided prior to celebration of the marriage. If this is done, then there are high chances that we shall forget about child marriages in this country. In addition to the legal possibilities that I've just mentioned, we also have other ways that we can ensure that this can be prevented. Sometimes people marry off their young children without knowing. So there is need to sensitize them. They could have media sensitization drives or through drama and music so that they know that it's illegal to marry off a child below the age of 18. In addition, the statistics we have from 2015 that I mentioned at the start can act as a guide for the National Identification Registration Authority, NIRA, to increase birth registrations in areas where child marriages are prevalent. And finally, we should ensure that criminal proceedings are pursued against parents who marry off their young children. And once we have good decisions, these decisions should be publicized. But like we have stated, we have to ensure that the law eliminates all the exceptions, like in the Customary Marriage Registration Act, the Hindu Marriage and Divorce Act, which permits a child below 18 years to get married. Next slide, please. So this discussion has been made possible by looking at all those references. If you get a chance and you want to appreciate child marriage further, you could refer to them. Next slide, please. Thank you very much for listening in. I hope we can have a wonderful Q&A. Thank you once again.
Thank you, Hadijah. That was a great way to connect the importance of legal reviews of CRVS systems to an issue that really affects girls more than anyone, child marriage. Now I want to introduce Olga Joos, who will be speaking about the gender-related chapter in the toolkit on stillbirth reporting. Olga is a senior technical advisor at the CDC Foundation, supporting the Data for Health CRVS initiative activities within the global CRVS team at the National Center for Health Statistics. She worked as a pediatric cardiac critical care nurse before shifting her focus to public health. Olga's focus in D4H has been in improving the quality of cause of death data with a specific focus on medical legal deaths and stillbirths. She co-authored the stillbirth and MLDI modules of the Legal and Regulatory Toolkit. When not busy with work, she's always busy with her 2 kids and husband and supporting her community as a councilwoman and vaccinator. We saw her photo in the opening slides of her doing that work. Olga received her master and doctoral degrees in public health from our own Johns Hopkins Bloomberg School of Public Health. Olga, great to have you. You have 10 minutes.
Great, thank you so much. And I hope my audio is okay, but I'll just increase it. So thanks so much for giving me the chance to speak about stillbirth reporting and registration as a topic in today's seminar on CRVS legal and regulatory review with a gender lens. In my short presentation, I'm going to spend a bit of time explaining equity as it relates to pregnancy and pregnancy outcomes, so you can better understand stillbirth as an equity issue. Next slide. Taking a big picture view of health equity, we see that in 2019, there was an 18-year gap in life expectancy between the poorest and richest countries. Looking more specifically at pregnancy, also in 2019, 1 in 41 women in low and middle income countries died from a maternal cause, compared with 1 in 3,300 women in high income countries. Once labor starts with contractions, the mother and fetus have a higher mortality risk than at any other stage in life, and that's globally. However, this risk is inequitable within and across countries. Next slide. The burden of disease for maternal and neonatal mortality in stillbirths is not insignificant. In 2017, there were an estimated 810 women who died each day during or following pregnancy or in childbirth. In 2019, there were an estimated 5,000 early neonatal deaths each day. These are babies born alive who died within their first week of life. In 2020, there were an estimated 5,000 stillbirths each day. The vast majority of these deaths occur in low and middle income countries, highlighting inequities in access to and quality of healthcare. Next slide. Now, looking specifically at stillbirth as an equity issue, I want to highlight just 2 results presented in this extremely informative table that we just don't have the time to review in detail. You can see the differences across high, middle, and low income countries as it relates to the stillbirth rate, with the highest rate of 39 stillbirths per 1,000 total births in Bangladesh, the country representing the low income country category. Note that this study is 10 years old, and now Bangladesh is identified as a lower middle income country. The stillbirth rate in high income countries is 2 to 4 stillbirths per 1,000 total births. So that's a big difference between 2 to 4 stillbirths and 39 stillbirths per 1,000 total births. The only other result I want to highlight is the percent of stillbirths occurring after the onset of labor, also called intrapartum stillbirths. They accounted for 9% of stillbirths in high income countries, 39% of stillbirths in South Africa, the representative upper middle income country in this study, and 66% of all stillbirths in Bangladesh, the representative low income country in this study. Access to and quality of healthcare are critical factors in stillbirth inequities across these country income groups. Next slide, please. Now you hopefully understand why stillbirths are an important equity issue, and you are motivated to incorporate stillbirth reporting and registration efforts into your Data for Health CRVS system strengthening work, for example, tied in with birth registration improvements. A strong legal framework is critical for stillbirth registration. So let's now take a look at how this resource, the toolkit, can support your efforts in strengthening stillbirth reporting and registration. The stillbirth chapter, oops, not yet. I see you. Okay. The stillbirth chapter covers key considerations that are applicable globally. Next slide, sorry. Starting with the definition of stillbirths, it's important to be clear on how we define this vital event. A stillbirth is the death of a viable fetus prior to birth. So after delivery, the fetus does not have a heartbeat or pulsation in the umbilical cord, does not breathe, or does not have any voluntary movement of muscles. Next slide. Having a clear definition of stillbirth is very important for its accurate reporting, given the potential linguistic discordance when it comes to pregnancy outcomes. The legal framework should be clear, or should clearly define vital events, not just stillbirth, but all vital events. And the system should include clear guidance for accurate classification of these vital events by health workers. Next slide. So if a stillbirth is a death of a viable fetus, what does viability mean? And viability comes from the Latin root vita, which means life. Given medical advances, countries have different standards for fetal viability. The stillbirth chapter presents recommendations for national statistics purposes, which you can see listed, as well as for international purposes. International classification standards are really important to incorporate in stillbirth law and regulations to avoid comparability issues across countries or data collection mechanisms. Next slide. This figure shows the use of different stillbirth classifications highlighted in a recent UNICEF report. You can see a range of gestational ages in months and weeks, and weights used as stillbirth classification. Lack of comparability greatly limits the value of data for analysis of trends and for purposes of measurement and evaluation. Next slide. The stillbirth chapter includes the two international best practices on tracking stillbirths. One approach is stillbirth registration reported to the civil registrar and entered into a separate stillbirth register. Another approach is through the health sector, with health facilities gathering required information and sending it to the Ministry of Health. Next slide. The stillbirth chapter also presents best practice recommendations on who reports stillbirths, highlighting the importance of the health sector in this role. Next slide. Half of stillbirths occur during birth, of which 3/4 are preventable with equitable access to quality care and early detection of at-risk pregnancies. I mentioned this to highlight the importance of medical certification of cause of death for each and every stillbirth, so that programs can be put in place to prevent this avoidable vital event. The stillbirth chapter presents the best practice recommendation of using the WHO recommended international form of MCCD to certify the death. It specifically includes a checkbox on stillbirths, as you can see circled on the right. Ideally, all stillbirths should have a medically certified cause of death assigned by a physician. However, the inability to medically certify a cause of death should not prevent the registration or reporting of a stillbirth. Next slide. The stillbirth chapter also includes the UN recommendations for information that should be recorded during civil registration in order to generate vital statistics. Here you can see the statistical topics that should be recorded, regardless of whether stillbirths are reported through the civil registration system or through the health sector. Next slide. I don't have time to cover all components of the stillbirth chapter in the toolkit, but want to show you the other topics that are also covered. These topics, along with those I presented, form the core components of a legal framework on stillbirth reporting and registration. Next slide. One thing I would like to highlight, what Chrystie already said, is that the legal framework is necessary but not sufficient to support best practices in stillbirth registration. You need the legal framework to be translated into processes and supported through the CRVS system for stillbirths to be actually registered. Fortunately, we have two excellent resources to support you and your country partners to strengthen stillbirth registration through legal framework and system process strengthening. The toolkit chapter that I just presented, which you can see on the left of the screen, and the joint WHO-UNICEF guidance for health program policymakers, managers, and development partners, which you see on the right of the screen. Resources are helpful, but sometimes you just need to speak with someone. So please reach out to me if you have any questions. I am happy to answer questions during the Q&A, but also via email. Next slide. I started my presentation with some big statistics: 810 women dying each day during or following pregnancy or in childbirth, an estimated 5,000 early neonatal deaths each day, an estimated 5,000 stillbirths each day. But I want you to think that each is, as stated by Dr. Tedros, a person, a family, a community, or a nation. And our task is to use these data to make evidence-based policy decisions to move us closer to a healthier, safer, fairer, or equitable, I would say, world for everyone. And as you can see noted in the image of a community health workers pregnancy registry on the right, every stillbirth counts. Thanks so much.
Thank you, Olga. The importance of capturing every stillbirth around the world is now very clear to me. I want to quickly turn to introduce Erin Schwid, who will be speaking about the chapter in the toolkit called Equal Access for LGBTI Individuals. Erin is an international human rights attorney and the director of public health law at Vital Strategies. He has worked with more than 70 countries to enact and implement public health laws on a variety of issues, including tobacco control, nutrition, epidemic prevention, road safety, civil registration, environmental health, and vital statistics. He regularly supports the World Health Organization and other UN agencies to develop legal guidance on public health issues, including UNSD's guidelines on the legislative framework for civil registration, vital statistics, and identity management. Erin obtained his JD at the George Washington University Law School. Erin, great to have you. You have 10 minutes.
Great. Thank you so much for the kind introduction. Today I'm going to be talking about the legal module exploring registration issues faced by lesbian, gay, bisexual, transgender, intersex, and other queer people. But first, next slide, please. I want to start with a bit of a hypothetical. I want you to imagine that you are working at a registrar's office, a local registrar's office, and a man walks up to you at the window and says he wants to get his national identification card, but he just realized that his birth certificate has an error on it. The birth certificate has him listed as a female, but as you can see clearly, he says, I'm male. You look at him, he looks like a guy to you. What do? Do you send him away and say there's nothing we can do to fix the error? He has to have female listed on his birth certificate, national ID, bank statements, school records, voting cards, medical records for the rest of his life. Every time he gets pulled over by police, he has to explain why he doesn't look like a woman. And then what happens when he tries to get married? Or do you use the process that you use for other amendments or corrections to civil registration documents? Do you require him to go to a court to see a judge? Does he need to go to a doctor to conduct a medical examination of his physical body, of his genitals? Do they need to run genetic tests, measure his hormone levels? What is required? Does he have to have friends and family write letters attesting that he's a male? Is a psychological evaluation required? What about surgical procedures? As a government agent and as part of a government agency, the question comes, what's the appropriate level of scrutiny that's to get to the correct answer without being too intrusive on the person? And importantly, from the legal perspective, who should have that responsibility? Is it the person at the local registry office? Is it somewhere higher up at the Register Generals? Is it a judge or a doctor? Or should this decision lie with the person himself? These answers are found in your laws and rules, and this will instruct how you move forward and how you handle this case. Next slide, please. And it's not just administrative errors which occur. They do occur. It's not a zero amount of administrative errors. Sometimes the incorrect marking of sex is actually a feature of the person's birth. There's a group of people who do not fit squarely within the male-female binary because of a medical condition, sometimes related to chromosomes, hormones, or their phenotype, or some combination of all three. And this group is under the umbrella term intersex. It's hard to define exactly what counts as intersex, and so it's also hard to estimate how many people there are, but the estimates hover around about 1%, give or take. But even the lowest kind of deeply problematic estimates that are out there would estimate that there are about 1,400,000 intersex people alive today, and that's the absolute kind of bare minimum. So this is a real thing that civil registers have to face. And it's extra complicated because many intersex people have no idea. What used to happen is if a child was born with ambiguous genitalia, doctors would assign the infant a sex at birth, often because for cultural reasons, but also for legal reasons, because you need to assign a child birth for their birth certificate. In almost all cases. And in order to assign the infant a sex, the doctor would often perform surgery on the infant to ensure that the sex matches what was assigned. Sometimes this determination procedure occurred with the parent's informed consent, but not always, and the child is rarely told. So as these children grow up, they hit puberty, their bodies start changing in unexpected ways. They may choose to live their life as a different sex than the one they were assigned at birth. Or they may recognize that they don't exactly fit within the male-female binary and choose to live without being either purely male or female as their body suggests. So now the better practice is will certainly ensure full, true, informed consent of the parents and not push surgery initially. But also sometimes new parents need time to decide how to move forward, and the civil registration system needs to give them time with an easy process to change the sex later once that decision is made or needs to be adjusted. And when the child is old enough to make their decision, they should have their own chance to decide what sex they want to live their life as. The fact that there are intersex people in the world forces us to think outside the pure binary of sex and consider our laws, which brings us to next slide. The question of transgender. Intersex is about people who don't fit within the male-female biological binary. Transgender refers to people who don't fit squarely with the gender they were assigned at their birth. Sex is physical. Gender encompasses many of the other characteristics that make us human. And transgender is an umbrella term also that for people who have maybe a combination of masculine and feminine traits. Or it can also include people who do fit squarely within a traditional gender, man or woman. They just happen to have been assigned the other gender at their birth. In most cases, as I said, but not all, we can tell sex at birth, but gender emerges later in life. Many cultures around the world have recognized and celebrated people over history who bridge gender roles. There are many of these longstanding traditions, though, were actually stamped out by colonial imperialist forces as they came through. But the world's starting to come back around, and proof of that is in the latest, the ICD-11, gender incongruence was moved out of the mental and behavior disorders chapter into conditions related to sexual health chapter. So it's no longer considered a disorder, it's just a condition that certain people have. Some countries have laws banning or criminalizing people who are transgender, but many are starting to amend their laws to prohibit discrimination and update their systems, including the civil registration systems, to accommodate and include transgender people on an equal basis. And the best example, the clearest example of this is the creation of a third gender category for identity documents, such as passports. This is an example from Pakistan. You can note this has been around at least 5 years. And there's an X gender marker to recognize that the person doesn't fit squarely within male or female. And this X marker is becoming increasingly common on passports and other ID documents around the world. Oh, sorry, next slide. This is the picture from Pakistan. You can see the X marker. Okay, and next slide. So as I said, it's becoming increasingly common. In fact, there are over 2 billion people in the world who live in countries that have access to an X gender marker on their passport, which means even if your country doesn't issue documents with the third gender, there's a higher chance each and every day that someone might visit or move to your country that has one of these X markings, and your CRVS system and other systems will need to figure out how to incorporate them into your system in many other ways. The other issue that comes up often, kind of a fact of the modern age, is that family structures are not always simple. Thank you, next slide. Children don't always have just one father and one mother. Sometimes an uncle might step in, or another community member might step in and lend his family name to the child of an unwed mother. Divorced families may have 2 birth parents and 2 step parents. There are all kinds of combinations of adoptions that are possible, whether married couples, single, grandparents adopting grandchildren. There are now same-sex couples that adopt, and this spans domestic and international. With advancements in fertility treatments, there's even more possibilities and opportunities that open up. I have a dear friend, a biological woman who is not able to produce eggs, but she found an egg donor. Her husband fertilized with the egg donor, and my friend is carrying the baby. And sometimes it's the other way around. The mother has eggs, but it's not safe to carry a child, so she needs a surrogate. And this process can sometimes cross international borders, with surrogates living in one country and parents living in another. This is for LGBT people, but also everyone else too. And your system, who you put on the birth certificate, how you adjust that, what gender is assigned, all needs to be decided in your laws. It gets very complicated quickly. And your country, all countries are going to need to adjust their systems and their laws to accommodate for different family types. Next slide, please. In addition to just recognizing people for their birth certificates, the other advantages of this is it allows them access to the system, and it gives us access to the health data, accurate health data that is so important for making health decisions. If you don't let people register as who they are, you don't have access to their data. And the system then perpetuates what becomes a self-fulfilling cycle. Stigma leads to discrimination. Discrimination causes people, in many cases, to take on risky behaviors. We know that in many times groups are more likely to smoke cigarettes. LGBT people are more likely to smoke cigarettes, use alcohol, take other risky behaviors. Transgender people might have access to black market hormones or surgery, but they also do other risky behaviors like avoiding going to the doctor or emergency room or calling the police because they're afraid of the consequences of that. And all of those risky behaviors lead to increased rates of disease. People often think of HIV, that's where your head goes to immediately, but really some of the major causes of death are lung cancer, heart disease. Also, things like violence and suicide need to be tracked as well. If you don't know who the population is, you don't have access to those statistics. Next slide, please. So the Toolkit module allows lawyers and other registrar staff to conduct a step-by-step evaluation of all of these issues. We present recommendations, guidance, and key questions for people to ask. And the recommendations are based on international documents, both the UN Statistics Division, Yogyakarta Principles, and then other key human rights documents. Next slide, please. Unfortunately, as with most, we don't have time to go through every best practice, but a few things that I want to highlight. First, it's just so crucial that you provide within the civil registration process a quick, transparent, accessible process for people to change their gender or sex and their name as well. If you can provide a third gender option, that's wonderful. And by starting to think outside of having just pure male and women through everything, you allow opening up different family types and ensuring that the rights of those different families, that especially the parents, are protected on the birth registrar and other documents. While we're trying to get data, and it's so crucial to have transparency, at the same time, the system has to balance that with privacy and confidentiality concerns. And the system itself must be accountable for making sure that the staff treat people with respect, and that the documents are protected, and there's enforcement mechanisms in place. Civil registration systems are incredibly complicated. They reach out with their tendrils into many other systems and agencies. So coordinating with those agencies across death registration, medical records, population registries, it goes on and on, is very complicated, and we help you unpack that. And then there's some other additional details we go through to unpack all this. Next slide, please. I just want to end with a quote from a woman someone in Canada, who got a passport that had an X marking on it. And it ends with this quote: "When I had my passport in hand, I felt like I had wings in more way than one. I felt like the possibilities were endless, that I could go anywhere as my true self, and there was space for me, and I felt happier." Next slide. So thank you very much. Look forward to questions.
Thank you, Aaron. You did an excellent job of defining the terms that participants have been asking throughout the series, and really amplifying why it's so important to get it right in terms of positive health outcomes. So thank you for that. Our last speaker today is Sophia San Luis, who has vast experience in conducting CRVS legal reviews. Sophia is a public interest lawyer specializing in public health policy development and advocacy. She is the executive director and a co-founder of ImagineLaw, Inc., a public interest law organization that designs and advocates for policies to help Filipinos live healthy and meaningful lives. Sophia manages ImagineLaw's Data for Health program, working with various countries to assess their civil registration and vital statistics legal framework and develop strong CRVS laws. She is currently working with the Solomon Islands, Maldives, Pakistan, and the Philippines. Before founding ImagineLaw, Sophia worked as a litigation lawyer and a legislative consultant in the Senate of the Philippines. And she also previously served as a legislative consultant for Vice Mayor, now Mayor, Josefina Belamonte of Quezon City, where she helped develop landmark legislation to prevent and control sexually transmitted infections, gambling addiction, and COVID-19, and to provide affordable housing for indigent Filipinos. Sophia received her JD degree at the University of the Philippines. Sophia, welcome.
Thank you, Michelle, and good day and good evening to everyone. So today I will be discussing the opportunities created by the CRVS legal review process in achieving gender equity and the challenges in maximizing these opportunities. In giving this presentation, I draw from my experiences in working with different countries in reviewing their CRVS legal frameworks and developing CRVS laws, though admittedly without specific focus on gender equity. As Aaron, next slide please. As Aaron mentioned earlier, CRVS systems are incredibly complex as they touch on different aspects of government. The product of CRVS, vital statistics, is used for policy and decision making, so you can already imagine how CRVS by itself can be a tool for achieving not just gender equity, but in general in bringing those in the margins at the center of government priority. Civil registration also establishes legal identity, which is a means for accessing government services. Thus, if civil registration legal frameworks do not adopt a gender lens, CRVS can, in some cases, be a tool for disempowering people based on their gender. So perhaps the biggest opportunity created by the CRVS legal review process is that its scope is so broad that it can bring to fore human rights issues. For example, in one of the countries that we work with, we learned that they already have a law that criminalizes child marriages by custom and by law. But their marriage laws still state that the marrying age is 18 for men and 16 for women, and that children below this age may still apply for an authority to marry. And this inconsistency in their law only came to focus because we were conducting a legal review of their marriage registration laws. The process that we use in undertaking the legal review also allows us to understand real-world challenges faced by the implementers, which in some cases are created by gender. When we conduct our CRVS legal reviews, we also make sure that we are able to conduct local or provincial consultations with the service providers who are at the front lines. In this way, we are able to see how and why actual practice deviates from policy. For example, in one of the countries where there was a strong drive towards technology-based registration, we learned that their data collectors, who are predominantly women, would have to travel for half a day to reach the next household to collect data, and then climb mountains and cross rivers to find cellular signal to send out the data. And these practices were not captured or addressed in their policies. But we also learned that it was predominantly the women who were driving data collection on the ground because they understood how it opens up access to services such as vaccination and schooling. And because it involves some components of capacity building and close collaboration with stakeholders, the process also enables us to cultivate policy champions. For example, here in the Philippines, it is already the Department of Health who leads in the implementation of our recommendations from our legal review back in 2017, which includes securing funding for research, that we did on medical legal death investigation recently. This means that if we are deliberate, we can also cultivate champions even for gender equity. And then finally, for the opportunities, the legal review process and the toolkit constantly evolves. I have seen it evolve from its nascent form when it was just an Excel sheet to the toolkit that it is now. It has evolved to be more user-friendly and perhaps more importantly, to respond to issues we've encountered along the way. The toolkit, as was shown by Aaron and Olga earlier, has new chapters that talk about how CRVS policies can shape norms to be more inclusive, but it also adds other more nuanced guidelines that take into consideration cultural practices. For instance, we learned in one country that we work with that women delay naming children because they wait for the father to name the child, and this delays birth registration. So the toolkit now has some guidance to allow the use of temporary names so that mothers will still be able to register their child on time. Next slide, please. Of course, these opportunities are not always fully maximized. Although the toolkit is broad, in my experience, it is always the country that dictates which chapters to use, and often countries, especially those with low birth and death rates, would only focus on birth and death registration. In terms of the process, consultations are often limited by budget and time constraints, and even more so now with the pandemic where we have to do consultations online. Ideally, we would want to consult not just stakeholders, but also beneficiaries to see how best practices can be adapted to their context and also secure buy-in for new policies. But in most cases, only government stakeholders are consulted. For example, here in the Philippines, we learned that through the legal review consultations that women delay registering births because the father works abroad and there is no mechanism to allow the father to confirm paternity while he is abroad. The Philippines has a lot of overseas Filipino workers. So stories like this are important in making sure that CRVS policies are inclusive, but often they are not captured prior to policy making. Of course, because the toolkit is designed to provide broad guidance, it also does not always address nor comment on unique cultural norms that may impact gender equity. For example, in one country that we worked with, we learned that they have a tradition where in case there is a single mother, it is the male relative who will step in as the father and register as the father. We were able to address the procedural side of this cultural practice by recording it as a guardianship instead of paternity. But we do not know if there are other things, other aspects of it that we should take into consideration if this has health impact or any other impact in terms of gender equity. Finally, because the legal review is focused on CRVS, the toolkit also does not provide guidance on substantive legal issues outside of CRVS. For instance, if I am working with a country that still allows child marriages or that prohibits divorce, as in the case of the Philippines, there is really no follow-through or no way through which countries can address these issues if they're just looking at the toolkit. The guidance that is provided in the toolkit does not go that far. Next slide, please. So to really maximize the CRVS legal review process so that it can be a tool for achieving gender equity, it is very important that it is fully utilized, especially for countries that already have high birth and death registration rates. Conducting a full legal review might help bring to light other substantive issues, including gender and human rights issues. This means that even if countries like the Philippines, for instance, already has 80 to 90% birth and death registration rates, they should still be encouraged and assisted in conducting CRVS legal reviews. The next thing is to make sure that the policymaking process that follows legal reviews adopt a gender lens. Consultations should go beyond just the government, but also include beneficiaries of different demographics so that we can understand how they interact with the system and whether CRVS is a tool for empowering them or disenfranchising them. And then finally, there should be a mechanism to link countries with technical assistance should they wish to address substantive gender issues that are raised through the legal review process. This can be achieved by involving CSOs and other advocates early as in the legal review process and stakeholder consultations. In this way, all the insights drawn from the CRVS legal review are not wasted. Next slide, please. So that's it, and thank you for this opportunity.
Thank you, Sophia. I appreciated you adding your perspective and giving some real country examples of where this work is taking place. Now we have just a couple of minutes for questions for each of you. I ask that you please try to limit your responses to 3 minutes each. The first question is for Aaron. What are some of your recommendations for CRVS policy and regulatory revisions so that countries where it is illegal to be gay, lesbian, or transgender can be more gender inclusive? Where do we start?
Thank you. Look, the civil registrars aren't in a position to change kind of cultural norms or laws in other areas. But looking just within the CR system, I think you start with acknowledging that intersex people are real and are present, and trying to design a system around it that is respectful, that doesn't embarrass them, doesn't force them through unnecessary bureaucratic hurdles, time, costs. And if you design your system around that, recognizing also that this is a private decision between a family and perhaps doctors, you're going to start going a long way in creating a more inclusive, respectful system. When looking at that, one conclusion you might draw is actually that for identity documents, including sex and gender is actually not that important on the documents itself. And you might consider actually not putting sex or gender on identity documents. Now, I just want to be clear, it's still important to track that information for statistical purposes. It's incredibly vital that we have that information for statistics, but on the identity documents itself, sex and gender are actually terrible biomarker. They don't tell you anything in terms of biosecurity, you can help people along the way by just removing that, and that's moving forward as one of the best practices.
Thank you. Sophia, did you have a response?
Yeah, sure. So I guess one way to start is to find out if the norms have already changed and try to capture those norms and into policy. So for example, here in the Philippines, which is a predominantly Catholic country, we still don't have divorce. But we've seen in recent years that the Catholic Church has issued canonical divorces, especially in cases of domestic abuse. And so this might be something that we should already translate into a policy and allow divorce in the country. Another example, for instance, is insurers here in the Philippines already allow same-sex partners to be beneficiaries for each other's insurances. Again, this is already a practice that should already be concretized in policy.
Thank you. Our next question is from an audience member for Hadijah. In Uganda, are there any considerations regarding banning bride prices as a legal option to reduce child marriage?
There have been cases involving bride price, but unfortunately the focus in the pleadings, they talked about the child marriages, but during the decision, child marriages were put to the side. So basically, we do not have a single case saying this is illegal, but we know deep down in our hearts and looking at our constitution, that child marriage is illegal. So I would recommend persons that are interested to know about this to look at at the chat because Deb has just posted the link, which explains the whole case relating to banning of bride price. The Supreme Court disagreed and said people can still pay bride price, but it said asking someone to refund bride price is unconstitutional. So that creates some kind of leverage that someone can get out of a marriage, but getting in, it must be paid. Thank you very much.
That's interesting. Thank you. Olga, a question for you. Another gender equity issue in registering vital statistics that was raised in the last seminar was about cause of death data related to gender-based violence. Can you speak to the medical legal death investigation system and its role in accurate GBV reporting?
Yes, I can. And I'll just start by repeating what I said in my presentation, that the legal framework is necessary but not sufficient. And this is the case for medical legal death investigation systems, or MLDI systems, and the reporting of gender-based violence. MLDI systems are informed by their legal frameworks and the language that specifies the deaths that should be referred. So that can be suspicious, unnatural, violent deaths, and they can be further specified. The legal framework can also specify the cause and manner of death should be determined by a medical doctor who conducts the physical examination of the decedent. And these are all really important for the examination of unnatural, violent, and suspicious deaths like gender-based violence deaths. But there's one impediment that can limit the reporting of gender-based violence on MCCD forms, or medical certification of cause of death forms, which would affect the data completeness of gender-based violence in vital statistics. And that's that the investigation and the death certification timelines may not align. And when the doctor is ready to certify a death, so that means to meet the certification deadlines, for example, the information on the perpetrator may be uncertain or unavailable. And that's one missed opportunity, especially with the implementation of ICD-11 and the rich details it includes on perpetrators and victims, as well as the type of assault, violence, or even neglect perpetrated. And additionally, from my work with MLDI doctors, I've heard their reluctance to report circumstantial information, such as history of domestic abuse, interpersonal violence, or other gender-based violence related details on MCCD forms. And I've heard from these MLDI colleagues that the MCCD form is for the reporting of cause of death, and the information they report on it needs to be defensible in court. It's a very defensive approach to certification. So without confirmation of circumstantial information, MLDI doctors are reluctant, or can be reluctant, to report it on MCCD forms. And so this is another missed opportunity for information on gender-based violence to be reported on MCCD forms, which would then allow it to be captured in vital statistics. So all of this to say, the legal framework is necessary, but not sufficient to ensure that gender-based violence is reported through the MLDI system's death certification process for inclusion in vital statistics. If revisions to the MLDI legal framework and process cannot improve reporting of gender-based violence on MCCD forms, then maybe the use of death review committees or femicide observatories should be considered as a mechanism to assess the burden and circumstances of these deaths for their prevention. Thanks.
Thank you. And Chrystie, I'm going to give you the last minute if you had a response to that question.
I'll just build on what Olga said, who is really our in-house MLDI expert, and I encourage all of you to join her amazing community of practice monthly meeting if you haven't already. I've learned so much from that meeting. Just to say that this is a real gap in the international best practices that exist. And it's a real challenge for us in the international public health community to address gender-based violence and understanding when deaths are the result of gender-based violence. As Olga mentioned, I've also sensed that same reluctance among the doctors who manage medical certification of cause of death to get anywhere close to the criminal side of things. They don't want to cast blame. They don't want to get in the role, become the prosecutor. They don't want to become the investigator. They are doctors, and they are there to determine the cause of death. And that is how they're trained, and that's how they think. And so they're very, very reluctant to to touch gender-based violence, which ultimately is casting blame on someone for causing it. So this is a gap. This is something we need to address. We need to think more creatively. Maybe it isn't the role of doctors to do this. Maybe it's the role of someone else in the MLDI process that we need to invent and create. Maybe it doesn't yet exist. But it is a huge problem and leads to a lack of understanding about how widespread gender-based violence really is. But thanks again, Dr. Kaufman, for this opportunity. It was really great to present on the legal review.
Thank you, Chrystie, and thank you again to all of our panelists. I also want to thank the Center of Excellence on CRVS Systems at UNFPA, who joined us on earlier seminars in this series. Today's seminar was the capstone to the Gender Foundations in Health Data series. All the speakers throughout the series helped to map out the work ahead that we are tasked with in order to integrate gender equity into our own work. Today, as at the end of all of our seminars, we are asking Data for Health partners to spend the next few minutes taking a brief knowledge check on the materials that were presented. This will qualify you for a gender equity certificate, and you can scan the QR code in the slides on screen or use the link in the chat. The next step in our Gender Equity Unit's work is to gather your feedback on the seminar series so that we can adapt and tailor the materials to create an everlasting digital course for global colleagues and partners. So please do look for a survey link in your inboxes in June for this evaluation survey. We are so delighted to be part of the Data for Health initiative, together leading the way for gender equity and health data. Thank you.